Hi, Dr. Scott Jensen here. It did not have to be this way. Flawed testing during the 3 years of the pandemic led to so many abuses of everyday life. Before I jump into the actual testing issues that I want to discuss, I want to point out that last week we were told that Dr. Walensky was resigning from the CDC. There will be plenty of Monday morning quarterbacks rehashing her performance. I'm certain that she woke up every morning trying to do the best she could. But wow, were there some problems or what? Some of the stuff you can't make up. WebMD came out with an article today. WebMD, news brief. Dozens of COVID cases linked to a CDC conference. Get this. Last week on May 3rd, 2023, more than 30 people who attended a CDC conference were infected with COVID-19 at the event. News sources that weighed in on this included the Washington Post. They said CDC opens probe after 35 test positive for COVID following the CDC conference. The Hill said CDC investigating COVID outbreak after its own annual conference. What's this all about? So more than 30 people who attended a conference were infected with COVID-19 last week. The CDC hosted a 4-day conference just outside Atlanta. It was to be a showcase for recent groundbreaking investigations and innovative analyses, better known as CDC's disease detectives. Well, now the CDC is working with the Georgia Department of Health to conduct a rapid epidemiological assessment of confirmed COVID-19 cases that appear to be connected to the conference. 2,000 people attended, said the Washington Post, who were likely to be fully vaccinated. So we have a CDC conference. Virtually everybody in attendance is most likely fully vaccinated, according to the Washington Post. This is in the WebMD article. And 35 people come down with it. You can't make this stuff up. But now, we need to remember that it was Dr. Walensky who said that the vaccines, those who get vaccinated, will not get the disease, nor will they transmit the disease. And then some 15 to 18 months later, she had to recant and acknowledge that indeed people who are vaccinated can get the disease and can transmit the disease. And many people, and myself included, are frustrated with her reversal because she should have known better at the front end. We're talking about COVID-19, a respiratory virus, and its first point of attack is generally in the pharynx, our throat, our nasopharynx, the portion of our throat that's behind the nose. That's where it goes. The virus goes there, attaches to the epithelial lining, to the mucosa. There are secretions there. It's a ripe environment in which these viruses can replicate, reproduce, if you will. And that's what they did. In the nasopharynx, up here, back in there, the virus attaches, replicates, and becomes transmissible. At this point in time, the antibodies that might have been created through a vaccine are circulating in the bloodstream, but there is no particular intersection between that bloodstream and where the viruses are lying on top of the mucosal lining in your pharynx. So it's almost as if, since the virus hasn't taken the initiative to dive into our bloodstream, the antibodies that are circulating around our bloodstream can't do anything about it. So the virus will replicate, and that person can cough, sneeze, and transmit it. That's why the vaccinated people could still get the disease, become infectious, and transmit the disease. That's one strike against Rochelle Walensky. But here's a bigger one, I think. And I have to say, David Zweig has been a remarkable researcher during this COVID-19 pandemic. He's contributed to a variety of publications, including some of the more well-known, slightly left-leaning journals, such as the New York Times. But he does an article on May 8th, 2023, yesterday, and he says the most important test you've never heard of. And this really matters. He's talking about a test that you may not have heard of, and I think it's important. So let's just walk through this quite quickly. In the spring of 2020, the public was bombarded with a message that would soon permanently embed itself into the national consciousness. These are David Zweig's words. People without COVID symptoms could unknowingly be infected and, more importantly, transmit the virus to others. That was the justification given by Tony Fauci when he did his 180. Do you remember? In February of 2020, he told the public, don't wear masks, it isn't necessary. But a couple months later, he got religion and he said, you got to be wearing masks. He said a lot of people who were asymptomatic were spreading infection. Well, now a paper from researchers at Stanford University School of Medicine and Stanford Hospitals raises an extraordinary prospect. Transmission from asymptomatic people is far, far less common than we were led to believe. How can they say that? Let's talk about that. The researchers at Stanford found a remarkable 96% of people who were PCR positive but without symptoms were not infectious. So I'm going to say that again. They took 96% of people who tested positive but did not have symptoms were not infectious. That one solo fact would have changed so much over the last 3 years. Businesses that were locked down, kids that were locked out of schools, nursing home patients that were locked in facilities, all of these kinds of horrors could have been avoided. Do you remember in June of 2020 when Dr. Maria Kirkov, head of the World Health Organization, said that transmission from asymptomatic people was very rare? She said that. She said transmission from asymptomatic people was very rare. And the next day, after criticism from varied health professionals, the World Health Organization officials walked back her statement, and you didn't hear Dr. Kirkov say that again like she had said it initially. Authors of an editorial reviewing the evidence of asymptomatic transmission published in the British Medical Journal in December of 2020, 6-7 months later, searching for people who are asymptomatic yet infectious is like searching for needles that appear and reappear transiently in haystacks. But some views went in a different direction. For instance, Journal of American Medical Association Network Open paper suggested that more than half of all transmission came from infected people without symptoms. So we're getting a complete disconnect. Okay, let's talk about the test, because that's where the problem lies. We were using a test, a PCR test, that was being cycled 35 plus times, sometimes 40, sometimes 45 times. Every time a cycle was utilized, an additional cycle, 35 to 36, we doubled the amplification potential. In other words, if you go from 2 to 4, the next one doesn't go from 4 to 6, it goes from 4 to 8. And the next one doesn't go from 8 to 10, it goes from 8 to 16, 32, 64, 128, 250, 65, 12, and it keeps on going. That's what it does. So when we were amplifying, as Tony Fauci said, potentially dead nucleotides in a person who was not infected, was not able to transmit the disease, but when we amplified it 45 times, we could indeed come up with a positive PCR test. That was the basis for so much of what went on. That was the basis for continuing the lockdowns. That was the basis for so many mandates. Let's talk about what Stanford found, and let's talk about when they found it. You need to understand that SARS-CoV-2 is a positive or a plus-stranded RNA virus. RNA and DNA exist in nature typically with a positive charge and a negative charge, and together they're electrically neutral, and that's important. So when COVID replicates or divides and goes from 1 to 2 and 2 to 4 and 4 to 8, in order for it to replicate, it has to do so with a minus strand, because the COVID-19 is a positive stranded RNA virus. So when it replicates, it produces a negative strand. The Stanford test that they came up with looked to see if a minus strand, a negative strand, was present. Because if it was, then the virus would be actively replicating, and that person would potentially be infectious. If the minus strand, the negative strand, was absent, then the virus is not replicating. Think of it this way. If this is the COVID-19, a positive strand of RNA, if it's going to replicate, it has to do so by producing a negative strand, and that would be this one. So when you put these together, you take this, and that wants to replicate. It does so by creating a negative strand, and they match up. When they match up like that, you can see that a perfect whole is made. What the Stanford researchers found was they looked for the negative strand, because if it was there, replication was happening. But if all they could find was nucleotides of the positive strand, then this may have been residual debris lying around. This might have been because too many cycles were utilized and the amplification was 45. This was big news. This would potentially allow us to say, okay, let's test for the negative strand. We know that this is the COVID-19 part, but let's look for this one. If we find this one, that person's replicating the virus and they're potentially infectious. That was what the Stanford researchers found. When did they find it? They found it in May of 2020. In May of 2020. Before the second lockdowns were necessary, before so many horrible things were done. The purpose of the test, Dr. Benjamin Pinsky, one of the authors of the original paper on the test, explained, was to help clinicians in the hospital accurately find out if patients were infectious or not. In other words, if a patient came into the hospital with a broken leg and they tested positive for a PCR COVID, they didn't go to the hospital because of symptoms of COVID. They went into the hospital because they broke their leg, but all of a sudden they were positive COVID. If we were running this Stanford test and finding that there was no negative strand, then we would know that patient wasn't infectious. So a test like this existed as early as May and June of 2020. If it had been rolled out in medical centers and regular labs nationwide, it could have enabled people to know for certain whether or not they were infectious. I remember having a beef with the fact that the lab companies weren't telling me on these positive PCR tests how many cycles had been utilized. Because if a test were positive with only 25 cycles, that implies much greater likelihood for infectiousness. If a test were positive at 45 cycles, it would be much less likely. Tony Fauci said this. Virtually thousands and thousands of people recognize this. But here, we had a chance to go even better. Better than simply reporting the number of cycles utilized to find a positive PCR test. We could have been looking for the negative strand and determine whether or not active replication of that virus was happening, because if it wasn't, then that person was not infectious. And that was the basis for where Stanford came up with the fact that 96% of people who were PCR positive without symptoms were not infectious. That raises a serious question. David Zweig says this: this raises serious questions for those in charge of the CDC, the NIH, and the NIAID. That's the one Tony Fauci heads up. For why resources were not allocated toward making this test broadly available. Regular people could have paid for the test to find out after they got a bout of COVID whether they were still infectious or not, enabling them to go to work, visit relatives, and so on. Researchers at Stanford later looked at the data from July of 2020 through April of 2022, and they answered the question health authorities neglected to answer. They found that for the majority of the pandemic, only 4% of asymptomatic SARS-CoV PCR positive patients were shown to be infectious. What a game changer that would have been. It makes me sick. It makes me ill. David Zweig, Z-W-E-I-G, he's got a Substack. When I think back to what went so horribly wrong over the last 3 years, I think to the testing. I think to the fact that we had to rely on models that extrapolated data in a ridiculous fashion. I remember in Minnesota, we were told by the governor that if we didn't do this, this, and this, we'd have 1,000 people dying per day in the month of July in 2020. Well, if you actually look at the data in July of 2020, the actual number of people who died of COVID-19 per day, many days never reached double digits. I remember the mandates, the lockdowns, the closures. I remember the arguments that we had about natural immunity. I remember when the vaccines rolled out, that we just were dealing with a mishmash. Why didn't the CDC and the NIH go to Stanford and say, what you have here is powerfully important? You see, this is what I think we have to go through the next several years when we look for accountability. This is not about revenge. This is about we need to glean from what we did over the last 3 years very carefully, because we were throwing dollars to the wind and not supporting the Stanford researchers that potentially could have told us that this person's not infectious. Because while they could find a red strand, they couldn't find the negative strand. And that means replication wasn't happening. We could have put Tony Fauci's nerves at rest when he said that he was worried that our PCR testing was being cycled so many times that we were detecting nothing more than dead nucleotides. We could have done both of those things. We could have looked for the negative strand to indicate replication, and we could have demanded very early on that labs and lab tests would tell physicians and providers how many cycles were necessary in order for that PCR test to become positive. Think about it. So as Dr. Walensky departs from the CDC, I would say thank you. Thank you for the work you did. I'm certain that you had many sleepless nights. But you certainly made some errors, and I hope that as you walk the next chapter of your life, you help lead America by acknowledging the errors and helping us do better the next time. Think about it, Dr. Walensky.